although the number of deaths from coronavirus in the UK is falling, around the world, the pandemic is still far from under control. Have a listen to the World Health Organization's Dr. Michael Ryan.
Each and every country has a different combination of risks and opportunities at this point, and it's really down to national authorities to carefully consider where they are in the pandemic. This may be a pandemic, it may be affecting the world, but it's affecting each and every country in a different way, depending on when disease came, depending on how the initial responses were managed, and depending on how the disease is evolving at this point. By no means is this over. If we look at the numbers over the last number of weeks, this pandemic is still evolving. It is still growing in many parts of the world, and we have deep concerns that health systems in some countries are struggling and they're under huge strain.
Well, one country certainly feeling some strain is India. The Chief Minister of Delhi is saying the city could have more than 500,000 cases by the end of July. And he says if that happens, there's no guarantee its hospitals will cope. We also got more detail on Mumbai today. Its total of COVID-19 cases has surpassed Wuhan in China, which is where the virus was first reported. And as a country, India continues to have one of the highest new infection rates in the world. Here's more from Yogita Lamai.
Delhi's Chief Minister Arvind Kejriwal has said that to cope with the number of cases his government is expecting to see in his city, they'll need as many as 80,000 beds. They're trying to ramp up capacity by acquiring beds in private hospitals, but we're hearing of so many people who are going from one facility to another, struggling to find a place where they can get their loved ones admitted. And that's not just the story there. Here in Mumbai as well, I've been talking to families who've lost loved ones before they could even be looked at by doctors. And even as these cases are rising, you can see cities in India are opening up. This junction looks almost like it did before the shutdown was imposed. Buses are back on the streets, auto rickshaws, taxis. Private offices are functioning up to 10% of their capacity. In many other parts of India, places of worship, shopping malls, even restaurants are open.
Now, this virus doesn't only affect people's health directly, it's impacting on so many other pressing concerns, which in turn affects people's health. For example, Johns Hopkins University is estimating that many hundreds of thousands of children in India will suffer from severe malnutrition, and potentially 300,000 of them may lose their lives in the next 6 months. And that dreadful prospect is not caused by the virus, but the virus is a factor. Divya Arya reports from Delhi.
Too much hunger, too little food. With jobs gone, it's a fight for survival. Hunger was always an issue here, but this desperation is new. For these children just outside the capital Delhi, even one meal a day now feels like a triumph. Shiva is just 1 month old. His parents rely on daily wages to buy food. And like millions of others, they lost work after the government announced a lockdown in March.
We used to cook rice, rotis and vegetables before the lockdown. Our children ate well. Now they remain hungry because we have no money and no work.
The Indian government has run a child development scheme to provide essential vitamins and nutrients to children up to the age of 6 through centers known as the Anganwadis. But during the coronavirus lockdown, most of the more than 1 million Anganwadi centers, such as these, were shut down. Now some of them are trying to home deliver a much smaller quantity of food supplements at a time when they're most critical for young children's development.
Now it's ordinary citizens who have stepped up, like Nilesh Singh, who has been distributing one hot meal a day to 500 children since the past 2 months. But that's hardly enough.
I can provide 1 or 2 meals, but children need breakfast, lunch and dinner. They're not getting the nutrition they need.
Now, while India is still very much dealing with its first coronavirus outbreak, there's growing evidence that there's a second wave of the virus hitting Iran. Let's hear from BBC Persian's Rana Rainpour.
Could this be Iran's second wave of coronavirus? The country was opened up from lockdown just about a month ago. And this is how it looks like now in one city, Javanrud. Buses are being used to transfer COVID-19 patients to the capital of Kermanshah province. It's one of at least 9 provinces where infections are rising rapidly. According to Iran's Ministry of Health, Khuzestan province in the southeast is now a red zone. The hospitals are full. The staff are overwhelmed. Last week, Iran recorded the highest daily increase in the number of coronavirus cases since the first were reported 4 months ago. Many local officials say this is a second wave of infections. But Iran's president insists that the term second wave creates too much fear among people. Iran's official number of confirmed cases is around 176,000 cases, with over 8,000 deaths. Yet many, including the Iranian parliament, believe the correct number of infections is 8 to 10 times more, and the deaths are at least twice as much. The president has warned that if people don't follow social distancing, the restrictions may be reimposed. But the economy, already badly hit by US sanctions and corruption, is on its knees.